Quebec's ombudsman says an Innu inmate who died after being transferred from jail to hospital experienced discriminatory treatment and a serious violation of human dignity. Our colleagues at Radio-Canada looked into this. The inmate Philippe Pinette died of severe dehydration after serving time at a Quebec City jail in 2022.
C'est sûr, c'est choquant, ça fait quelque chose.
Fontaine says his brother was diagnosed with schizophrenia at age 19. Before the diagnosis, he said his brother was good at drawing and he described him as an artist. The provincial ombudsman investigated Pinette's final months, and Radio-Canada obtained a copy of a letter the ombudsman sent to Pinette's brother. The ombudsman says in the months leading up to his death, various institutions failed Pinette's care in terms of diet, hydration, hygiene, and medical follow-ups. In summer of 2022, Pinette was in jail in Sept-Îles after being convicted of attacking staff at a psychiatric hospital in Baie-Comeau. Pinette was transferred to the Quebec City jail in September and placed under the care of Dr. Alain Bissonnette. Bissonnette is now facing a criminal charge, failing to provide the necessaries of life. The criminal charge isn't directly connected to Pinette's death, but just to the care he received during the 9-day period he was incarcerated in the Quebec City jail. Bissonnette's lawyer tells Radio-Canada her client has pleaded not guilty and will vigorously defend himself. Radio-Canada obtained copies of search warrant documents from the police investigation that offer some details into Pinette's final days at the Quebec City jail. One correctional officer told officers she observed Pinette rolling around naked on the floor of his cell. Prison staff told investigators Pinette's body was clenched, his fingers were cold, and he was often staring blankly into space. One nurse told investigators she recommended daily that Pinette be transferred to hospital, but she was told that her requests were refused by Dr. Bissonnette. It was only on September 11th, 9 days after he was transferred to the Quebec City jail, that Pinette was finally transferred to hospital. Pinette was placed in an artificially induced coma. He died a week later. A group that advocates for Indigenous healthcare says this story is tragic, but not surprising.
The link we made of all this situation is to the systemic racism that still impact Indigenous person and impact the way they are cared and how they are treated when they express like pain.
Cabinet ministers couldn't say much because of the ongoing investigation, but the Premier weighed in.
Je trouve ça déplorable, en fait, la situation qui semble être survenue. Je m'attends à ce qu'on n'ait plus ce type de situations qui surviennent.
The Ombudsman made recommendations including improving nursing care in prisons and also reinforcing the idea of cultural safety. The province passed a law 2 years ago that obliges institutions in Quebec to consider language, culture, and history when caring for Inuit and First Nations patients. The regional health agency that manages care for prisoners in Quebec City says it's already implementing those recommendations.